Alright, this is video number 2 in this series. So what we're going to talk about here is how to perform synchronized cardioversion for SVT. So if you have questions about pad selection and pad placement, refer to video number 1. Pad selection, pad placement will be exactly the same. Alright, so you've got a patient here that you've already got connected, and you can also refer to video number 1 on how to actually get the cables connected to the monitor. So you're on, you're connected, and we've identified this as SVT. This rhythm for most pediatric patients is going to be a little bit slow, but we're using an adult card on the rhythm generator, so just humor us and we'll pretend that this rate is a little bit faster. So the first thing after we've determined that this is SVT is it stable or unstable? If it is stable SVT, you're going to go down the path of using vagal maneuvers, medications, and then down to this. If it's unstable, you immediately go to synchronized cardioversion. If it is stable and during your treatment and at some point it becomes unstable, again you go straight to synchronized cardioversion. So the first thing you always want to do is sync. It matters when you give the energy when you have an actual pulse like this. If you give it on the wrong spot, you can push the patient into some other type of lethal arrhythmia. You'll know that the sync function is working because you will see these little triangles that show up on the monitor there. Now, your starting dose for this is going to be a little bit lower than defibrillation. We'll use 0.5 to 1 joules per kilo. So we'll pretend that we got a 10 kilo kid here. I always like to start with 1, so we will press energy select, dial this down to 10. You're going to press charge. You're going to look at the patient, verify that no one is touching the patient, and because it matters when you give the energy, it may not always discharge right when you press the button. You may have to hold it for just a second, and it will deliver the energy. Now notice after we've done this, the sync function has left. So if you're going to give a subsequent dose, you will always have to press sync again. And you'll see it pop up with the little triangular hash marks there. More than likely they're going to increase the dosage for the second round, so you'll press energy select again. You can go up to 20. Whatever you're ordered to do. Once again, you will press charge. Look at the patient, verify that no one has hands on the patient, and hold down the charge button.